Attendees are in listen-only mode.
Okay, it's 9:30. We're going to begin the webinar. I'd like to welcome everybody to the webinar, Incident Notification and Risk Management Rule Changes, Breakout Session B. This is Breakout Session B. We are rebroadcasting the breakout session from October 13th. So if you attended at that time, it'll be very similar, if not exactly the same, as the report that we gave then. So we'd like to welcome you on behalf of the Ohio Department of Mental Health. And we will be offering CEUs for this presentation today. You must be logged in separately. If you have two people in the office, you need to each be logged in under your separate login that you received on your email. And that way we have a record of your attendance. If you have questions during the webinar, at the last broadcast we did have the option of raising your hand, but we had a lot of trouble with that particular feature. So I believe we're not going to be doing that today, but if you do have questions, there is the ability to type in a question, and we will periodically stop and look at those questions and answer those, and then at the end we will try and catch up and hit any questions that were missed. So feel free to ask a question along the way. And the webinar is being recorded. We are hoping to be able to post this webinar on our website fairly soon after the broadcast. So keep an eye out for that on our website, and you'll be able to have folks in your agency or yourself listen to it at a later time if there are questions that come up. The rules that we're talking about today are the community rule, which is the Ohio Administrative Code 5122-2613. You see the web address there. And the residential rule, Ohio Administrative Code 5122-3016. We made changes to the rules for incident reporting. Those will take effect January 1, 2012. We did automatically enact the changes in July 1st, 2011 of those incident reports that will no longer be reportable as of January 1, 2012. We went ahead and took those incident reports off so that you didn't have to report them in this interim period between July 1st and January 1st. If you have questions about that, I believe we do have a posted webinar that relates to that particular those particular changes that is posted on our website. As far as the changes go, and some of the reasons why we made the changes, the old rules were very broad in general and didn't provide a lot of details as to what you were supposed to report. The new rules provide more detail related to what's required by each agency and provides greater clarification, adding clear definitions to what incident types and subtypes are reportable. The intent of this is really to eliminate, most of you are aware of the fact that there was an old document that is called the reporting instructions, and that provided some guidance for agencies as to what was reportable and what the department required to be reported. Our intent in making the rule more detailed and the definitions more clear in the rule itself is to eliminate this old reporting instructions document. Now there will be a reporting instructions document that is in place until December 31st, and then as of January 1st, 2012, the rule itself will be your instructions as to how to report and what to report. Both of the rules, the community and residential rule, have the following changes. We added definitions. Those are in Appendix A. We will have a recording of the webinar that dealt with Appendix A posted soon as well, I believe. We also added that agencies must create a system that includes a mechanism for review and analysis of all reportable incidents such that clinical and administrative activities are undertaken to identify, evaluate, and reduce risks to clients, residents, staff, and visitors. Additionally, both require that as part of the PI process, there's a periodic review and analysis of reportable incidents. Additionally, both rules require your agency or facility to maintain a log of reportable incidents. The department, those should be made available to the department upon request. They also require the reporting of alleged abuse or neglect to proper authorities. And both rules add the 6-month reportable incidents, which is going to be the primary focus of what we're talking about today. That is for the period of January 1 through June 30th, which would be due on July 31st, and then the period of July 1st through December 31st, which is due on January 31st. So we'll talk a little bit more about that in just a little bit. In addition to what we've talked about so far, both rules require an incident to be forwarded to ODMH and the Mental Health Board within 24 hours. Both provide for the department's authority to investigate incidents, and both require that a reportable incident be filed on the appropriate form. We have a draft form that I want to review. And folks have asked in the previous webinar whether the community incident report is available as well. And at this time, we're presenting the residential form because the format will be very much the same for the community form, but we do not have the community form ready to be posted as a draft out there at this time. The format, however, will be the same. So I wanted to take a look at the form itself. We wanted to be able to try and keep it as a one-page document, but that was not really possible. So we do have it as a 2-page form. We feel like it's more clear as to what is reportable. If you look at the top section, it's mostly demographic information, provider-generated incident number, date of that you're submitting it to us, date of discovery, much of the same information that you would have filled out on the old form, including the notifications that you made, including to the ADAMAS board and which ADAMAS board you did report to, and Children's Services Board and others. As you go down through and look at the form itself, if I can move back up, there we go. You'll notice that it has all of the reportable incident types that will be reportable as of January 1st, 2012. We have added in some places more detail. For instance, in the column on the left-hand side where it says involuntary termination of treatment by facility without appropriate resident involvement, without informing client, providing a reason and offering a referral. It has all those pieces that are necessary. If one of those is not done, it becomes an involuntary termination. And some of the other detail as well. You'll notice that we tried to provide as much detail in there to help folks so they don't have to refer back to the rule if possible. The definitions are in the rule, however. Now, as we go down to the bottom, we have, you'll notice the ability to report multiple residents in this one. In the community form, it will have multiple community clients that you'd be able to report. In the past, we've had you report multiple incident reports for an instance, for say, if you have a sexual assault between two clients. We've had you in the past report 2 separate incidents that relate to that one sexual contact. In the future, you'll be able to put that all on one incident report. We do want you to be able to mark in the top section each of the incident types that apply. So rather than just picking the one, in the past we've said pick the one that's most descriptive. In the future, we'll ask you to mark each that applies, so that you'll mark more than one if it applies. For instance, if there is a situation in which there was an unauthorized use of restraint, and the client said that there was excessive force used with them, or something that relates to a physical abuse allegation, you would mark both of those categories. Additionally, there may be other people who are involved. We've added to our incident report rule the fact that injuries to staff are also reportable. So that would be in this lower section where it says others involved. You would just mark staff initials or something that would help you identify who that staff person was if we have to do any kind of follow-up. And then there's the ability to give some additional information. So hopefully the form will be easier to use and will be something that you know, you'll be able to just go to and figure out what the incident types that you need to report are. All right, let's go back to the slideshow here. All right, just an update on the WEIRS system. WEIRS is the web-enabled incident reporting system. It is a way that agencies have been able to report incidents directly on the web to our database. As of January 1st, we will no longer have the WEIRS system available for you to report incidents. The department is in the process of pursuing an update to the WEIRS system so that we can accommodate the changes to the rule, but at this time we don't really have an estimated date as to when that will be completed. So in the interim, starting January 1st, 2012, you will need to report all incidents on a paper form to one of these 2 ways, either via fax or via email, which you'll be able to email it to the department at incidentreport@mh.ohio.gov. There were a couple questions right after we spoke about this at the last webinar, so I do want to just say that again. In the interim time between January 1st, 2012 and when we're able to get the WEIRS system up and running, you will have to report the incident on a paper form, which will be either the residential form that I just showed you or community form. We'll talk a minute about the 6-month reportable categories. The 6-month reportable categories that are in the rule will replace the PI survey. The first 6-month report will be due July 31st, 2012. That means January 31st, there will still be another PI survey that's due for the period July 1st through December 31st, 2011. So the first 6-month report will be due to ODMH July 31st, 2012 for the period January 1 through June 30th, 2012. Just a couple of things to go over definitions. The first definitions that are on the 6-month reportable part of the rule talk about hours of service, and hours of service means the total number of hours of service provided to all clients. It's a total volume. You'll see in the 6-month reportable data for community agencies that under partial hospitalization, under Crisis Intervention Services, and under Other Services, you'll see a need to list the total number of unduplicated services that were provided, and we'll get to that when we look at the actual form. Unduplicated client services means the number of clients served during a specific time frame. Each person can only be counted once, regardless of the number of services he or she receives. It would be the total clients. So for a partial hospitalization, if you were counting the number of clients who were served during that time, you would count just the total number of services in that 6-month period, the total number of clients you had on your rolls for that 6-month period of time. Okay. For residential facilities, the definitions that are listed in the rule say resident days. Resident days means the sum of all census days less the sum of all leave days, or authorized or unauthorized absences. So if you have someone who is AWOL or someone who's in the hospital and is not counted during that day, that would be just taken off your total resident days for that month. And when we get to the actual 6-month form, I'll show you the chart, and it will, I think, be clear that there's a place to put a resident day for the number of resident days for each month during the 6-month period. We did have a question during the last webinar about how many hours does a person have to be on site to be counted. Our rule is not prescriptive about that. Most agencies have policies around what they require in terms of a person to be counted on their census that day, and I would assume most agencies will just follow that. It should refer back to your policies around that issue, I believe. 6-month reportable category definitions, just to kind of go over so we're clear about some of the definitions for special treatment and safety measures. Mechanical restraint means a staff intervention that involves any method of restraining a client or resident's restricting a client's residence or resident's freedom of movement, physical activity, or normal use of his or her body using an appliance or device manufactured for that purpose. So mechanical restraint, appliance, or device. Physical restraint, also known as manual restraint, means a staff intervention that involves any method of physically or mechanically restricting a client or resident's freedom of movement, physical activity, or normal use of his or her body without the use of mechanical restraints. So physically restraining a person, to a person restraining another person. Additionally, the definition for seclusion means any staff intervention that involves the involuntary confinement of a client, resident, alone in a room where the client or resident is physically prevented from leaving. And then the last definition is transitional hold, and transitional hold means a staff intervention that involves a brief physical, also known as manual restraint of a resident face down for the purpose of quickly and effectively gaining physical control of that client or resident, or prior to transport to enable the resident to be transported safely. Now, we did get questions last webinar about what length of time do we consider brief, and does it have to be face down? I think this particular, the way the definition is written, is face down and brief, but it doesn't describe how long brief is. It's assuming that that hold is very brief and just long enough to be able to get control, to get the person in a position where you can safely either transport or safely transport. So we don't give a time frame for that, but it does say brief, so we would assume that it's not going to be an excessive length of time. 6-month reportable data forms. We're going to look at the actual rule itself in just a minute, but the first page of the rule for the 6-month reportable incidents is the same for both community and residential. It has the agency's name, facility name, has your certification or your licensure number, and it has the name of the operating or residential facility operating agency. So if you're a large community mental health agency and you're reporting on one of your residential facilities, the name of the agency will be the residential facility name, and the name of the operating agency will be the name of your community mental health agency. And the license number will refer to that residential license. So just to keep those things clear, these are things that are to be marked on the first page of the 6-month reportable incident. It will have contact information about the person who's completing the form, the person that you would like for us to do follow-up with if we have questions about the data that you've reported. And then it will ask you to mark which period that the data applies. So you'll mark either January 1 through June 30th or July 1 through December 31st. I'm going to go ahead and switch to the actual forms. Excuse me. And I want to do the residential one first because I think it is a little shorter, and then we'll get into the community one because it has a little more detail. For the residential form, you'll see again at the beginning the fact that there's the demographic information. At the bottom of the form it says, in Part A, residential facility policy prohibits the use of seclusion restraint in all certified services, and the residential facility did not utilize seclusion and restraint during this reporting period. If that is true, if you mark the box in A, then you are finished with the 6-month reportable data, and you could just send that in and leave the rest of the information blank. However, if you do have incidents that you have instances of restraint or seclusion, then you would move on to the next section. At the top of that page, you'll see that there are some definitions that we just talked about, and then at the bottom, it asks for several things. It asks for the number of resident days per month during that reporting period. So you'll see it has January and July. You would just circle either January or July as to which it applies. So if you're doing the 6-month period for January through June, then you would just circle the top one. And I think circling January is sufficient. And then just enter the number of resident days per each of those months. In Section C, then if your facility did utilize seclusion and restraint during that period, you would move on to the next page. And the next page has a chart, and it just starts with seclusion for ages 17 and under. Has the number of episodes of seclusion, the total minutes of all seclusion episodes, and then for those over 18 it has the next section. Then it goes down to mechanical restraint. For those over 18, because mechanical restraint is not approved for kids under 18 years of age. Then it moves to physical restraint for those under 17, physical restraint over, transitional holds, and you'll see it just has the same format all the way down, the number of episodes, number of minutes per month. So that's the residential 6-month reportable data. It's pretty straightforward, I believe. And next we'll move to the community. There we go. Okay, Now under the community, first page is the same basic page as the residential form was. At the bottom under Part A, if your agency prohibits the use of seclusion or restraint and you did not utilize seclusion or restraint during this period, then you would mark that box and you would be done as well with the reporting. If, however, your agency did require that, several pages down, we get to the first set of questions that relate to the types of services where you may have utilized seclusion or restraint. The first is crisis intervention services, and under this you would check the appropriate box below. So if your agency in the first box is not certified for crisis intervention or mental health services, you would check that box, and then you would continue to Part C. We'll get to Part C in a moment. If your agency policy prohibits the use of seclusion or restraint in your crisis intervention services, then and you didn't utilize any seclusion or restraint during that period, then you would continue to Part C as well. However, if your agency did not utilize seclusion or restraint in crisis intervention service during the period, but you're certified to do that, then you would complete Part B, which is below, and you would move on to Part C. We'll look at that just a moment. And then the last one is seclusion and restraint was utilized in crisis intervention services, so you would complete Table B1 and Table B2. Table B1 is just the total unduplicated crisis intervention mental health services and the total hours of crisis intervention mental health service that your agency provided. So unduplicated clients served and total number of hours that you provided of crisis intervention services. Move on to the next page, Table B2. And Table B2 is very much like the forms for the residential, where you would just provide, again, the total number of episodes of seclusion, total number of minutes for seclusion for each of the age categories for seclusion and restraint that was utilized during crisis intervention services. And then moving on, Part C is for partial hospitalization services. So the first one was crisis intervention services. Now we're looking at partial hospitalization services. And again, your agency is not certified for partial hospitalization service, then you would continue to Part D, which is below. We'll look at that in a minute. If your agency policy prohibits the use of seclusion restraint in partial hospitalization service and your agency did not utilize seclusion restraint during the reporting period, then you'll move on to D as well. The next one, if your agency did not utilize seclusion restraint in partial hospitalization services during the reportable period, you would complete Table C1 below and then move to D. And if you did have the utilization of seclusion restraint during partial hospitalization, you would do C1, C2, and then move on to D. So again, total number of unduplicated partial hospitalization clients and total hours of partial hospitalization service. And we're asking that you also tell us how long the partial hospitalization day is. Move on to C2. C2 for partial hospitalization, again, is very much like the last chart for crisis. For each age group, you would just put the number of episodes, number of minutes for the total for the time period of January or July through the 6-month reporting period. And then we move on to Part D. Part D is all other mental health services, excluding crisis intervention mental health and partial hospitalization services. So if in your agency there was seclusion or restraint utilized in another area of your mental health services other than crisis intervention or partial hospitalization, you would mark that here. So first box, agency prohibits the use of seclusion restraint other than in crisis intervention and or partial hospitalization, and you didn't utilize it in other services, just mark that box and you're done. If your agency did not utilize seclusion restraint in all other mental health services during that period, maybe you allow it but you didn't have any, you're finished there if you mark that box. And then seclusionary restraint was utilized in mental health service other than crisis, and then we would move on to the table D1, which again is the number for each of the age categories for the 6 months that are reportable. So those are the 6-month reportable categories. Let me move through these fairly quickly, these slides, because they refer to what we just talked about. Oops. 6-month reportable forms are part of the rule. If you go to the rule web page, you will, as you scroll down, they're the last part of the rule, and you should be able to access them that way. And we have time available. Let me look at a couple of things. We had some questions during the last webinar session that we had. We had questions around the issue of the clients. When we looked at the form, you have you mark the ADAMUS board or ADIS board that you reported the incident to, and we had a question as to on the resident notification form, is the ADAM or CMH board of residence, is it the board where the agency is or the board from which the client is coming to the agency from? In what we're asking you to report, we're asking you to report the ADAMUS board from where the client comes from. This becomes more of an issue for residential facilities who receive clients from around the state and from out of state. So if you are, let's say, a residential facility and you are located in Franklin County and you receive a client from Montgomery County, you would, when you have an incident report that to Montgomery County, and you would put that on the form that you reported it to Montgomery County, and ODMH will send the incident report to the county where your agency is located, so to Franklin County. So we will forward it on to Franklin County. This was a committee of stakeholders who met a number of years ago to decide how each county who has an interest in knowing what incidents took place at a facility would receive notice or receive a copy of the incidents. And the rule says that it must be reported to the county mental health board, but doesn't say which. So because ODMH doesn't know where the client originated from, we have asked agencies just to report it to the county where the client is from, and because in our system we know where the agency is located and which county that is, so we will send it to the agency to the county where the agency is from. I have a question right here that just came up. Our residential homes are ODJFS certified, but we are ODMH certified for their therapy services. Would we use the community forms or the residential forms? That's a good question. You would use the community forms, and you would report on those incidents that take place during the provision of mental health services. Any of the types of incidents that would take place during other times, during, say, residential hours in the evening or something like that, would be reported to ODJFS. So you'd use the community forms. We have another question. Is my understanding correct that you would only report the number of hours of service and unduplicated count if you allow restraint. That is true. If we go back to the community form and go up to the very beginning of that, if you aren't certified to provide seclusion or restraint, this part A would apply, and it says your agency prohibits the use of seclusion or restraint. Now, if you are certified to provide those services but just did not provide them, we'll go back down here to this section, and you'll notice where it says agency did not utilize seclusion or restraint, it asks you to go to section B1, and it does ask for unduplicated crisis interventions, clients served, and the number of hours. So if you're not certified to do that and your agency prohibits it, then you would not have to provide the unduplicated number of hours. But if you do provide it, but you just didn't have any seclusions or restraint during this period, then you would do that. I think those are the questions that have come up so far. We did get questions along the lines of the ODJFS services that are provided, and one of the questions that came up during the last session was, it says, for agencies with licensure by ODJFS, such as foster care and other residential services that provide mental health services, do we report incidents that occur for these clients, for instance, anytime or only when mental health services are being provided? Also, do you consider foster parents staff of the agency, so all allegations of abuse and neglect by foster parent providing care to a youth receiving mental health services would be reported? The answer to that, foster care typically is licensed through ODJFS and not ODMH. Many of the foster clients that agencies have do receive mental health services. Excuse me. So most of the reporting incident types are reportable if they happen during the provision of mental health services or on site of the agency where mental health services are provided. Incidents that might take place in the foster home generally are not reportable. However, if the person is a mental health client and there's a suicide or one of those categories that would be reportable regardless of where it happens, the foster child commits a homicide or is the victim of a homicide, those sort of things, it would still be reportable even though it happens in the JFS foster care home. Now, as far as the foster parent being an agency staff, as we consider them a mental health staff, I think in most cases that would not be the case. If you happen to have a foster parent who is licensed in some way and is providing mental health services, that might be an exception to that rule. But if you have a foster parent who is accused of a physical abuse or some sort of abuse, that should be reported to ODJFS. Other questions that we received last time, someone asked if we will have a web version of the 6-month reporting forms available. And, will we have PDF forms that you can fill out and save to your computer and email or things of that nature? And the answer is that is our intention. We want to be able to have forms that you can access, fill out, save to your computer, and either fax to us or send via email. So I just want to reiterate, because part of that question was also about whether WEIRS will go away. WEIRS will not be active. You won't be able to access that as of January 1, 2012 until we're able to upgrade that system. So you will want to, just as a reminder, submit those on paper form. Another question that we received from the previous webinar was, previously sexual assault was only reportable if committed during the provision of service or while the client was at a community agency. Is this still the case? That is still the case. Sexual assault is reportable if it happens on site during the provision of care, and it is non-consensual. Another question that we received last time, just to kind of cover some of these because they are questions that have come up in the past. It says from the previous webinar, and this is the webinar, the combined webinar that will be posted on our website. You list homicide of a client as a new incident to report as of January 1, 2012. On the incident notification form, there's a box for homicide or suspect homicide by a client. Actually, on the form under death, there is the homicide of a client, and then there is a separate category that's just below that that says homicide by the client. So we separated that out as a different category. There was a question last webinar about the HIPAA identifier number for a client, asking, is that something that we're assigned? Is that a statewide number assigned to the client by the department? And the answer to that is no. The HIPAA identifier number is a number that is unique to that client that your agency assigns to that person. Typically, agencies have used a client's agency number, something that they can easily identify that that's that client, as opposed to we do occasionally get folks who put their provider-generated incident number in the HIPAA number box, and that's typically not what we're looking for. We would want you to enter a number that's unique to that client. So HIPAA number is just something, and there should not be any names or anything included in that. Just looking at the questions that we received last time. If you have questions, feel free to type those in and send those in also so that we can address those if you have any questions. It's asking if, in general, agencies need to report to the board for all reportable incidents, and yes, that's true. You should report to the ADAM board, the mental health board, all reportable incidents. All right, I think that is all of the information that pertains to what we covered in the previous webinar. If you have questions, certainly ask those. It looks like we do have one question that just came in. It says, the incident reporting rule changed in July. Can you clarify, besides the 6-month report, what is different? You want clarification of what's different as of July 1st, or what's different between July 1st. I'll go and what I'm looking for is you just hold a minute. Trying to find my, actually I may be able to find it on the major differences between the July 1st changes, which eliminated in July, what we eliminated for community agencies were attempted suicides, self-inflicted injuries, accidental injuries, medical emergencies. There was a category on the serious bodily injury section that said unknown. We eliminated that unknown category. We eliminated use of force by law enforcement. We eliminated, or we changed the definition a little bit for medical error and for adverse drug reaction. And the previous definitions for medication error or adverse drug reaction spoke to if there was permanent harm or there was the potential for, or it could have caused permanent damage, you had to report it in the past. The new language says if there is actual physical harm or death, then you need to report it. But in the past, so we made it very clear it has to have actually had a serious impact on the client as opposed to that potential. For residential facilities, we as of July 1st, 2011, we removed accidental injuries, illnesses, medical emergencies, serious bodily injury unknown again, use of force by law enforcement, and again, just the changes in medication error and adverse drug reaction. If I bring up the form for us to review, if you look at some of the categories here, I can speak just partially to the clarification on the question that it's the changes between July 1 and January 1. So what I just covered for community and residential were the changes that were made for July 1 that we decided to enact in July 1 as opposed to waiting till January 1st. I think, unless there are any other questions, that concludes the webinar for today. We appreciate you joining us. I believe I have another slide here, if I can get back to it. You will receive 1 hour of CEU credit for this session. Remember, you had to sign in individually to receive that credit. Remember, because this was originally approved for 2 hours, psychologists won't receive a CEU for this unless they're attending this, have attended the first session on October 13th and are also attending this session. We'll be emailing an evaluation form to each of the participants today, and once you receive that, complete it, send it back to us, and we've received that. We will send the certificate to you with your CEU credit. And again, we thank you for your participation. We hope to have the recording of this posted in case you have staff who weren't able to attend either the October 13th or this webinar, to make it available for folks to be able to listen to and get clarification on anything that they may have questions about in the future. So thank you for your participation, and I believe that's it. Have a good day.